Vascular disease is any abnormal condition of the blood vessels, the arteries, and the veins, and everyone's at risk. I recently talked with Dr. Paul Sasser at Conway Medical Center. He is a vascular surgeon about these conditions, including stroke.
Well, I'm a surgeon, so from my perspective, I'm the carotid guy, what they call me around here. The carotid arteries, which you have two in your neck, and they can get blocked up and they can cause strokes, and that's preventable. And so I would say carotid surgery is probably one of the most common things that I do, and we do it very well here. I think my stroke rate's about 1%, and the national average is about 3%. So we're doing really well here at Conway with the stroke surgeries.
So how are strokes preventable?
The thing about strokes is this, they don't give you a lot of warning. It just more often than not happens, and they need to be screened with ultrasound. And so the hospital's in the process of building a life screening system for free. So we'll have free screening going on shortly. And they can come and get in the free screening program. And like I said, for the carotid arteries, you may not know that you have the disease until you have the stroke, and then it's too late to put the toothpaste back in the tube at that point, you know. And so preventing the stroke ahead of time is just much more beneficial. And so if we can find a blockage or find a lesion that's surgically correctable and fix it, then they have a very high chance of avoiding a stroke by having it preventable through surgical procedures. And then there's medical procedures too, aspirin and things like that. But coming to me, most people are coming to me to talk about a pretty advanced situation where they would have a stroke if we didn't do a surgery for the most part. Baby aspirin, 81 milligram aspirin a day is a great treatment. In fact, I will see dozens and dozens of people and put them on aspirin for every one that I operate on. So that's kind of the mainstay. I'd say antiplatelet medication, Plavix for worse people, but avoiding tobacco use is a very big part of it. I don't have that many people who have strokes or have surgery from me that aren't smokers. So that's a very large part of my business is from tobacco use.
How do you know if you're at risk of a stroke?
They probably would not know that they are at risk, but if they're over 62, there's a program available. They can have free screening. And particularly if they're a smoker or diabetic or anybody in the family or overweight or eat like we eat in Horry County, we are a hot spot for vascular disease in our area. And so most of the people I would recommend for screening are probably anyone who turns 62. We're going to have a free screening program going on starting this summer. And so we'll have on the website and various places where you can go and find out what you need to do. You have to contact us to get in the free screening program, but we'll make it happen. They can come here to my office where I see the regular patients and everything, and they can have a free screening done through the program. And you know, they have to think about it, which a lot of people don't until it's too late. So if you are over 62 and you think you may have eaten a lot of good Southern food and smoked and diabetic and had a family history, then you're pretty high risk for a stroke around here.
What are the signs and symptoms of stroke?
Most of the people I see who have stroke, they may not be able to speak. They're trying to get the words come out, but they can't. They may have some facial paralysis. Typically, stroke classically is a unilateral paralysis, meaning one side of your body goes out. So people will say, I tried picking up the coffee cup, or I tried writing my name, and one arm or one leg is not working right. So typically a stroke is half of your body or half of your face, or sometimes a window shade over your eye. It's kind of a warning sign. And some people just have little syncopal episodes where they pass out, you know. And so the signs and symptoms of stroke that I told you about, if that happens, you need to go to the emergency room pretty quickly to get evaluated.
Moving now to peripheral artery disease, also called peripheral vascular disease. So what is it?
For the most part, you're talking about limb loss or bad blood flow to the legs. And it starts off people who can't walk, their legs cramp when they try to walk, and then it can turn to sores that don't heal, and then it can turn to limb loss. And so I see a lot of people who claudicate who can walk a half a block, their legs hurt, they have to stop, and then they can walk again. That's kind of the first sign. Diabetics, smokers, and people with bad cholesterol, they get hardening of the arteries, atherosclerosis, like my mom and daddy's pipes at their house, they get all rusty over time. It's just the aging process that people get. And so over time, if you live long enough, you're going to have your arteries start to get closed off. And if it's in your heart, it's a heart attack. If it's in your carotids or in your head, it's a stroke. If it's in your legs, then it's a limb amputation. And in the world, as many people as live in major cities like Albuquerque, that many people lose limbs in the world every year. And so there's a very major thing, and particularly in our area, it's very, most of the patients I have a relative or have a friend or family member who's lost a limb. And so most people have been affected by it, and it can be very preventable as well. And like I said, we have an excellent screening program for that. You know, we have non-invasive lab here that we can screen. And we're going to set up free screening for that, you know, this summer. So if people think they may have vascular disease or peripheral vascular disease or leg, critical limb disease, you know, we can certainly screen for that. It's very easy. Take a blood pressure cuff and put it on your arm. Take a blood pressure cuff, put it on your leg, and just check the difference. Very easy to check that. Peripheral arterial disease, again, is probably that and stroke are probably my two main things that I do all day long. I used to be more of a general surgeon, but now vascular is really my passion, you know, and so now that I've gotten to be over 50 and I can do what I like, I really have found that peripheral vascular disease has just been my calling, and I just love it. And the thing I love about it is, you know, helping a person to not lose a limb is just so rewarding. And also, I'm kind of a technology geek, and so the technology in the vascular world has just exploded in the last 10 years. And so we have wires and catheters and balloons that have drugs on them, and lasers and stents with drugs on them, and everything I do now is through a needle pretty much. We don't do the cutting and sewing big surgeries like I used to do. So it's all very minimally invasive, very safe. I mean, we have, you know, less than single-digit complication rates on these major vascular procedures now. And so it's just doing peripheral arterial work anymore has gotten away from what you would consider typically big surgical procedures into very minimally invasive procedures.
I also talked with Dr. Sasser about aneurysms.
Aneurysms are also very silent killers. Most of the time, people who have a ruptured aneurysm won't know it until it's too late, and then they don't make it to the hospital a lot of times. And so you can screen for an aneurysm with an ultrasound in the office. That's easy. Very much runs in families. So if you've had a family member with an aneurysm, you need to get screened, and anybody over 50, we can screen them. They have free programs for that. And the aneurysm repair now, as compared to what it used to be a big surgery. And now it's all done with stents and wires. They're very high tech. The hospital just built me a Mac Daddy room. I mean, it is the state-of-the-art, nicest setup in the area by far. And we've done some aneurysms over there, and having a room like that and a crew like that and just all of the state-of-the-art equipment at the hospital went in full. I mean, they went all in on this room.
We also discussed venous disease and what it is.
And venous disease, I think, is becoming another thing that I'm starting to see more of. Like I said, at the wound care center, probably 80% of the people at the wound care center have venous disease. And then you have cosmetic venous disease as well. It tends to be, you know, you see people who have large distended veins in their legs, they don't like the way they look, or their legs get very discolored, you know, like a purple, dark color, or they get a wound that can't heal very well because the legs are so swollen. And so just that whole spectrum from the pretty lady that has a vein she wants to have go away, to the person who's been going to the wound care center for 6 months with a wound that they can't get to heal. There are really new technologies for that, and I'm the only one that I know around here doing a lot of these things now that are, I've been doing them for a couple of years, that are pretty advanced. You know, I think the one thing people don't understand, the advanced techniques and things that we have at Conway, which are really comparable to any place. I spent the last 2 years going all over the country with this program about every 3 months to some of the big major vascular centers all over the country, and I can say I learned so much in the last 2 years, and I've gotten our program up to speed now with what's happening at the major centers in the country now. So it's really been fun for me to kind of take this on and kind of take it up a notch, you know, and try to build the program here. And the hospital has just been so supportive of me. So it's really been a fun time for me to kind of rediscover the fun part of my job, you know.